Should we start the session now?
Yes. Our guest is already there.
Okay, sir. So, good afternoon, good evening, and good morning to everyone. Uh, Today is the 1873rd day of uninterrupted daily webinar of International Forum for Promoting Homeopathy. And today's our guest is Dr. Chiranth, who is MD Homeopath and has done postgraduate diploma from International Academy of Classical Homeopathy. Uh, He is a director of Srishti Homeo Clinic, Nelamangala, practicing since 2010, and he also he was a member to Karnataka Board of Homeopathic System of Medicine in 2012 and known to be the youngest member for the board. And he has also served as secretary for Karnataka Qualified Homeopathic Doctors Association since 2012, and he is also serving as vice president for Karnataka Qualified Homeopathic Doctors Association since 2016. And today's topic is on importance of diet in treating diabetes mellitus. So let's welcome Dr. Chiranth sir, and let's get valuable insights from sir. Over to you, sir.
Good evening, everybody. Hope I'm audible to everyone.
Yes, sir.
Okay. So good evening once again. Thank you, IFPH, for giving me this opportunity to share some of my views regarding importance of diet, the today's topic in management of diabetes mellitus. See, as a doctor, why do we have to understand this is very important? Because India is the capital for diabetes mellitus in the recent days. We know that. And in the curriculum, be it a MBBS doctor or a homeopath or Ayurveda, where it is, we are not taught about what diet we are supposed to prescribe for the diabetic patients, which is very essential compared to other diseases. So, as it is not there in the curriculum, how we are going to prescribe the diet for the patients? So, in general, all these years, we heard something from our seniors. Based on that, we used to suggest the patients what to eat, what not to eat. We are homeopaths from different schools of philosophy, following various theories, where we prescribe based on the constitution, based on the totality of symptoms, some peculiar symptoms. How we are arriving at this minimum is a different issue. That everyone is expert in that, in their own methods. And when you are prescribing the medicine, how fast do we observe the blood glucose levels reducing? That is one of the very important thing. What minimum we are giving on what basis? That's a different thing. So today's main focus is on the diet, which will definitely give a very good result once properly prescribed. And let me share my screen for the PPT.
Yes.
Hope this is visible.
Yes. Everything fine.
Yes,
You
sir.
can go ahead.
So, importance of diet with homeopathic management of diabetes mellitus. So, what we were instructing till date, you can type your answers so that we can have an interactive session. In general, what were the suggestions we were giving to our patients regarding what not to eat? Audience can leave your messages here in the comment box. Change in lifestyle, okay. Regarding the food, what they are not supposed to eat, what was the instruction in general we were giving? Avoid sweets, yes. Yes. Avoid carbohydrates, yes. Rich foods, yes. So let us go in detail about it. So all these years, what practitioners, it is not just homeopaths, all the systems of medicines, the practitioners hailing from all the systems of medicines, they used to prescribe like eat jaggery, not honey. Eat jaggery and honey, but not sugar. That was the general instruction what we were giving. In Karnataka, we call ragi mudde, which is the ragi ball, and chapati. Avoid rice. This was the general instruction. Like we were saying, eat ragi ball and chapatis. Avoid rice. Avoid ghee, butter. When you come to rice, South India is this is the staple food of South Indians. So that avoiding rice will be a major task for them, and that's a challenging thing for the diabetic cases. And we were saying avoid ghee, butter. And most of the people had a notion that eating carrot and beetroot would increase the levels of sugar. Don't eat egg yellow. In general, we used to prescribe avoid meat. So these are the popular things which we were instructing, prescribing our patients to do and not to do. But years later, when researches were done by many people, practically speaking, when you consider the jaggery and honey, nowadays what you are getting is it is all adulterated, mixed with sugar syrup. We have seen that major honey companies were mixing sugar syrup in honey so that that was out in the news, adulterated honey and other things. Jaggery, once again, pure jaggery, we are not getting anywhere except for few places, and lot of adulteration. They are mixing sugar with some coloring agents and many other artificial agents and making jaggery out of it, which is definitely harmful for health. And that is the reason we are not suggesting jaggery for the patients. And coming to ragi ball, chapati is made of yes, avoid the underground grown veggies. Yes, we were saying chapati. Chapati is nothing but wheat. Wheat is once again a carbohydrate. Ragi is also carbohydrate with some fiber. And rice. Rice nowadays, what we are getting is polished rice, where the outer coating that is polished and taken away, the inner endosperm is given, which as soon as you take it inside, the rate in which it is coming into your bloodstream, that pace is very much increased compared to the whole grain rice, what we were getting earlier days with the outer coating. So that is one thing. And in general, we were saying avoid ghee, butter, all these things. Carrot can increase, beetroot can increase the blood sugar levels, all those things. So, but is this correct or not? We will just go through with the further slides. So how is our diet at present when you look into your plate, how is our diet? It is generally rice, South Indians, rice, sambar, idli, sambar, dosa, sambar, and lemon rice, tamarind rice, various flavored rices we get, pulavs we get, and plate full of the same thing we are going to eat. Some of the places they eat a lot of salads. stir fried or raw salad, however it is. Some don't have that practice. They're mainly into the rice and sambar and rasam kind of things. Tamil Nadu, we get a lot of dosas, idlis, rice, rasam, that too in a plantain leaf, full meals. So this is in general how we are following our diet. But how it should be. So every meal should be a balanced diet. You see, in this, they show the 40% of your meal should be of vegetables. And 25%, only 25% should be carbohydrates, which is either ragi, wheat, whatever you are eating. Today's presentation, we have taken as diet in management of diabetes mellitus. But this can be considered for those who are non-diabetics also, and those who are pre-diabetics, and various other complaints like hypercholesteremia and other things I'll tell you later. All of them, this diet is common. So 40% of your plate should be with vegetables. 25% of it should be with carbohydrates. And next 25% for non-vegetarians can be of the proteins of animals who are used to take eggs and other meat, red meat kind of things. And 10% of healthy fat should be there in your meal. So this is a balanced diet, how it is supposed to be. But what we are doing is completely against this rule. So once this habit is cultivated since the younger days, once you cross your 30s, 40s, you will be fit and you can push the diseases at least 5-10 years ahead. Because of it is not just the diet, the stress and other things, the genetics, the chemicals, what we are consuming in the forms of pesticides and other things, the fertilizers, which is coming with the vegetables and fruits, what we are eating. Certain diseases we have to face. We cannot get rid of everything. So how much we can control, that can be done with our proper diet. Okay. The main culprit is sugar. So sugar, especially the refined sugar, there is one chemical which is added, which is called as aspartame, to enhance the sweetness of the sugar 25 times the natural sweetness in that sugar. Just imagine how much harmful that is. You see, when we talk about sugar containing things, in general, we focus mainly on the cakes, sweets, biscuits, those things. But we have sugar in everything that we are consuming nowadays, which is available in market, which is nothing but the fruit juice, smoothies, syrups, the white rice, as we have spoken about it, the outer coating, which is polished and removed, only the endosperm we are taking, which is converting into the blood glucose at the faster pace. And potatoes, starchy vegetables, raisins, dry fruits. See, we were saying you can take dry fruits, but the dates and the raisins is the dried grapes. This is called as sugar bombs because it is very rich in sugar. And crackers and breads, pasta, all these things, processed food, packed food, that is all containing sugar very heavily. We will see in the further slide how much sugar it contains. So unless we avoid these things, forget about controlling your diabetes. Though your remedies are helping, working, and your lifestyle is not good, insulin resistance is more, and if you are consuming these things without control, used to take all these things, forget about bringing your sugar levels down. If you observe this slide, you see ketchup has 3 tablespoons of sugar, and crackers, 5 pieces of crackers will have, which is 4.8% of the daily recommended amount of sugar. Yogurt, 42.5% of the daily recommended amount of sugar it contains. 125 grams of sugar will contain 4.2 teaspoons of sugar. Cheese, 2 tablespoons of sugar. Juice, 250 ml will contain 4.2 spoons of sugar. So every product, processed food, what we are getting in the market is containing sugar in very high levels, which is more than the prescribed percentage. So when you start consuming a combination of this, like 2000 kilocalories of the that is the maximum amount of calories which is allowed for a person to take in a day. When you consume all these things, it will cross more than that. So when you consider these kilocalories, I will tell you, for example, if you run on a treadmill for 1 hour with a speed of 60 kilometers per hour, if you run for 1 hour, you are going to burn 100 kilocalories of energy. And if you consume just a piece of sweet, it will contain more than 500 kilocalories of energy. So just to burn 1 piece of sweet, you have to run for how many hours? 5 hours, according to this calculation. 1 piece of sweet you have to run for 5 hours. Just imagine 10 years down the line, 10 years before. Since 10 years, how much quantity of sweets and other sugar containing things we have consumed? Have we burned that amount of energy what we have consumed already? If you look into your photos, old photos 10 years before and now, if you compare, that will give you how much extra energy what we have consumed all these years, which we have not burnt, and it is deposited everywhere in the free space. So continuous consumption of these things will lead to various metabolic disorders, like just this sugar can cause hypertension. Cancer is also related. There is also a research saying if you cut down the sugar intake, carbohydrate intake in cancer patients, which will not allow the cancerous growth to develop, it will regress. This is correlated with PCOS, heart disease, dementia, non-alcoholic fatty liver disease, insulin resistance, lipid problems, high cholesterol levels, and type 2 diabetes, which we are talking about now. All these things are interrelated. Once you consume this in higher levels, all the excess amount of sugar will be deposited in the liver and various other parts of the body, like coronary arteries and other things. Here in the liver, it is causing non-alcoholic fatty liver disease, heart blockages, PCOS. Again, lifestyle is also accompanying this, sedentary life habits, cholesterol problems, and lack of activity will again hand in hand go with this sugar consumption to cause insulin resistance. So overall, all the organ systems will be affected with this sugar intake problem only. This is one more slide which is showing sugar consumption leads to decay, gum disease. In the skin, it causes early aging, and acne is also related with this. Heart, we have discussed blockage of coronary artery. Sugar in the gut will spoil the microbiome of the digestive tract. In the brain, it will be a reward center for dopamine, and this is more addictive than cocaine, sugar consumption. Most of the people, in general, you have observed that, if you have observed, you eat anything, like you avoid rice and start eating all the vegetables, stir fried or salads, pan fried, whatever, all those things. And you do it for 1, 2, 3 days, you feel whatever you eat will not be as satisfactory as you eat rice. Only after eating rice, we feel satisfied. That is because the amount of sugar levels which is sensed by your brain, you're feeling happy. So that is the level of addiction what we have had in daily consumption of excess amount of rice and other carbohydrates. And liver, once again, it causes overloading of liver with sugar in the form of fat, which is similar to that of overloading with alcohol. It is called as non-alcoholic fatty liver disease. So what are the things we are supposed to avoid? You see, the breads, the corn, that sweet corn, American sweet corn, pretzels, the potato chips, the fries, the potato, starchy vegetables. First of all, it is starchy and we are going to fry it in oil, which is doubled up in the calories. And that is definitely going to be overloaded in the body when taken. The pastas, the beans, cereals, high carbs, the candies, sweets, high carb drinks, Coca-Cola and other, let us not name the brand here, but uh, all the juice, whatever colas and sweet juices, what we are getting outside, the baked food, bakery food, rice. See, some people will say, Doctor, you give medicine, control the sugar in the medicine itself. I want to eat these things. It is impossible to bring down your sugar levels unless and until you take higher doses of allopathic drugs. You see, ice creams, bananas, potatoes again, bread, pineapple, pasta, all these things. So, what to eat, what not to eat? In the carbs, see, we have discussed all the navadanyas, what we call the cereals, pulses, they will be rich in sugar. So, we need to know the glycemic index of the food, whatever we are eating, which is low glycemic index. You just see 0 to 55 is considered as low glycemic index, which is apple, wheat cereal. There are certain forms of wheats available in the northern part of India, which has a low glycemic index. So those things can be used. You see, soya beans 18, cashews 21, grapes 46, brown rice 55. You see, sugar is 65. And refined sugar will definitely be high, whichever is available in the market nowadays, that will be very high. Raisins 64, cheese, pineapple, wheat thins, the nachos, the corn chips, all those things. You see, the pumpkin is 75, the juice is 78. The pretzels, which is the knotted kind of baked pastry available in the Western countries, 83 is the glycemic index. And that can be compared with the donuts, which is available here. White rice, it is 89 glycemic index. So all those food, this is readily available in the internet, whichever is having good glycemic index levels, low glycemic index, we can consume those things. This is one more slide, which is in detail showing the glycemic index of various food items. All those in green can be consumed. Yellow is medium, red we have to avoid. So you can take a screenshot of this. Brown rice, the coastal belt area, people are some of the areas using the special type of rice, which can be having good glycemic index. White rice is definitely high. We have to avoid. You see this, whatever you see here is rich in carb. Based on the glycemic index, we can because that is also having proteins. We cannot completely reject those things. Sprouts and everything are required, but not in large quantities, in regulated quantities. How a plate of meal should be. You see, the berries, green leafy vegetables, the avocados. We have spoken about carbohydrates till now. Now we will talk about the proteins. Proteins, most of the people will be misguided. All these years, even the doctors didn't know how to prescribe. They had a notion that having non-veg also can cause increase in the sugar levels. See, the eggs, the meat, whatever it is, mutton, chicken, fish, those are having habit of consuming non-veg. The milk, butter, buttermilk, ghee, all these things, they are not related with increasing your sugar levels. So can be consumed. Some people will not consume mushrooms as their food habits. Those who are having the habit can take. So you don't have to worry that your meat containing fat, all those things. Fat, again, you should think that is not a good fat. We'll talk about the healthy fats now. But meat as such can be consumed in the regulated quantities, which is not increasing your sugar levels. Coming to the fats, we have the bad fats, which is in the left part of this slide, like soybean oil, all those unsaturated, saturated fats, corn oil, all these things. Deep fried things should be avoided. All the good fats is olive oil, avocado, which is a fruit, which is the only fruit which is allowed for the diabetics to eat. It has a good fat that doesn't have sugar in it. Like all the fruits what we are getting nowadays are hybrid, which are very bigger in size, good in color, rich in fructose and glucose levels, which will increase. Some people will say, which fruit can we take, sir? Can we take papaya? It is supposed to be good. Guava. See, every fruit, if you give the patient and check, it will increase the blood sugar levels, except for this avocado. And salmon has good fat, coconut has good fat, avocado, this butterfruit, and the nuts like almonds, walnuts, these things have good fat. All the other dry fruits you have to be very careful about, especially the raisins, dates, which are very rich in sugar. This is one more slide. You see omega-3. If people are not having the habit of consuming non-vegetarian, omega-3 is available as fish cod liver oil capsules can be taken. And you see the walnuts. So right part of this slide has unsaturated fats, which are good. You can eat them. And towards this left part of the slide, all those things which you are seeing should be taken in regulated quantities, very less, very minimal. And as we have spoken about deep fried things, once again, we have to avoid. You see, this has vegetables, some amount of proteins, avocado, it has berries and eggs for proteins. You have the fat, you have the vegetables, you have the protein part. Everything is mixed. This is supposed to be your balanced meal in every plate of meal. Like you can mix varieties of things and all the permutations and combinations can be done in your, so that it should not be a boring thing to have these things. And this is practically what we are suggesting to our patients. Like, you have a glass of buttermilk, carrots are there, and tomatoes. These are the small bananas, not rich in sugar like the bigger bananas. You see, the boiled beans, carrots, and one citric fruit. We have tomatoes and egg. If such kind of diet is followed by the patients, I'll show you practically when applied in cases how the sugar levels were controlled. This is a meal given to a patient. If that patient was taking ragi ball or chapati with 500 mcg of the allopathic mg of allopathic medicine, whatever she was taking, the sugar levels were shooting up to 285, like that, 275, 285 with ragi roti or ragi ball or wheat roti with 500 mg of tablet metformin. And this was the meal given to that patient. Like, you see one carrot and cucumber, cabbage stir fry with a coconut piece, dry coconut piece. And half of the tablet was given. 500 divided by half is 250 mg. And the sugar was checked. You see in the meter, the person who was supposed to get 280 with ragi and wheat with full tablet, now with half tablet, the ppbs sugar, this meter, it is showing 148. That is the level practically you see in the patient controlled. So all these things what we have spoken about, now let us apply in the patients and see. This is the patient who freshly, in a very short time, I'll be just few cases are there, I'll show and I'll finish. Am I exceeding time?
No, we can go ahead.
Yes, sir. Yes, sir. So this was a freshly diagnosed case of type 2 diabetes mellitus, 45 years male. His fasting level blood glucose sugar was 262 and his ppbs was 405. You see the date 5/12/2024, last December this was the case. He did this because he got a complaint where he was unable to control his urine. Incontinence of urine was seen for 2-3 days suddenly. Before rushing to the toilet, he used to just pass. That was the complaint. And after that, he checked this and he found it to be 405 after food, that is the ppbs sugar. And when he checked his HbA1c, it was 10.4%, where the mean glucose sugar was 263.6. So then he called me and said, these are the levels. I said, anyway, it is too high. It is better you visit one allopath, because I was outside. I said, you visit one allopath, you start off with the medicines, and then you get back to me, I told him. So he went to an allopath and he was prescribed these medicines. Okay. Based on the same levels, 262, 405, 10.4 was the HbA1c. He was given some medicines. And after taking that medicine, he checked the sugar levels again. And you see the fasting was 197. Urine fasting sugar is 1%. Postprandial is 326. 405 was ppbs before starting allopathic medicine. 326 was after starting allopathic medicine with 1.5% of postprandial urine sugar. Then he came back to me. His case was taken. He was diagnosed since 5 days, and these were the levels what we discussed. Just because of incontinence of urine, he got this tested. And after starting allopathic medicines, he says feet pain has started. You see, 6 to 7 times in the day, night he has to wake up for 5 times. After allopathic medicine, it is reduced. And this was his presenting complaint. And you check the past history. 2 months ago, he found his urine to be having offensive odor. Mouth ulcers were seen before. And father intestinal cancer he had. Surgery was done and he's under chemotherapy. And mother NS. And coming to the mind symptoms of this patient, he had bulimia. And he has a provisional store where he used to be in the not just in cash counter, he was giving the products to the people. And whenever, for example, he's giving raisins and dates and he's selling it, after the customer has taken it, he used to just pop few things into his mouth. So daily, morning till night, something, some or the other thing he used to just pop up when he is giving to the customers. So, and also very frequently he used to be seen outside in various eateries. Bulimia. He's a known person. So I used to see him everywhere. And by nature, he's cheerful, happy, not so much bothered. He says he's angered easily because when he's in shop, some customers used to bargain, and that was the time he used to very easily angered. And earlier he was throwing things in anger. Nowadays it is reduced. And his fears of dead bodies. He doesn't like to visit any funerals or those things. Hospital sufferings, Andre Agala means that suffering he cannot take it. Sensitive to suffering. And the smell of the hospital, he cannot bear. And when you come to the desires, he says honey cake, aversion apple, appetite is too much, and thirsty, and for cold water in summer he takes Sprite, he says, cold drinks. Salt 3+, sweets not so specific, spices 2+, sour normal, aversion to milk. Except apple, he likes all fruits. Ghee 1+. He is towards hot. Stools are regular, and perspiration is in the scalp and neck. And after repertorization and his nature, all these things were considered, and he was given phosphorus 200 TAD 3 days with PL for next 5 days, 3 days, 5 days. It was alternated for 2 weeks. And this, whatever we have discussed, the type of diet was also advised. You see, here he had the levels of 405 before starting allopathy. After starting, it was 326. We have started homeopathy with proper diet. Okay. You just see, 9th, that was the reading. 326 was the PPBS. Just within 2 days, just see how fast this type of diet can give you results in reducing the blood sugar levels. Chapati, tomato, onion palya with salad, he says. He has taken chapati and some tomato and onion with salads. His fasting sugar is 126. PPBS, you just check, it is 138 within just 2 days. With same amount of allopathic medicine what he was taking. And you just see previous, and they used to send me picture of what they were eating. This is for your perusal. You can just see the quantity of carbohydrates, whatever he was taking is reduced with the sides, cucumber, carrot, all those things were increased. So previous night he had upama. Date also you can see in the WhatsApp chat screenshot. And you just see the next day PPBS is 155. And 14th They are saying 13th night they had Shauge bath, the vermicelli with salad. And today before food it is 122. After food is, he's saying 82. Poha, cucumber, carrot, beetroot, tomato, all these things he had. You see, PPBS after food is 82. So suddenly it is coming back to so much lower levels. So what he has done is he has reduced his allopathic medicine by half. And even after reducing to half, his PPBS is 113 and after food is 150. So by default, he's thinking now with half also the sugar levels are just 150 and other thing. It should not be suddenly lowered and it should not collapse. That's the reason. What he has done is he has stopped allopathic medicine and with the same kind of diet, he's sending me whatever he is eating and he's showing me the glucometer readings daily. Why daily? I'll tell you. So you see 136 and 144. These are the sugar levels what he is having. So within just 2 days, these are the results what he is seeing. You can see. I had this same presentation in Davangere in a national seminar in last December. So until that day, I was taking the readings. So that it was a very fresh case. I had to present it there. And you see the next in April, that was in December what he had done. April HbA1c was done. 125 was the FBS and PPBS was 202. You just observe the HbA1c levels 7.4 without taking allopathic medicine. So some people might be thinking, just controlling that can give good results. Why homeopathic medicines to be given with that? Can be done. If it is controlled, fine. If it is not controlled, yes, because your insulin resistance has to be handled. That is done with your medicines. And I'll show you some more cases. Well, this was a freshly diagnosed case, so it was very helpful to easily track it and present it to the audience. There was one more old lady who was also freshly diagnosed in previous August, where she had 323, where fasting urine sugar was 3 plus, 431 was the PPBS, and 4 plus was the PP urine sugar, and 9.3 was her HbA1c with 220, the mean sugar. I said, you start with allopathic medicines, whatever is there. And I gave some tips. She was an old lady, 68 years, you can see on the report. She's controlling with the proper diet. I advised you start with allopathic medicines and you continue our medicines. She was prescribed, and next there is a slight lag. This is the next report. She came with 181 with traces of fasting urine sugar. 234 was the PPBS and 1 plus was the report. She said tablets were finished. I think that's the reason it has come 234. Also, it should be much more lesser. Tablets were finished means I said you don't stop the allopathic medicines just like that. You continue that. I thought it to be she has stopped allopathic medicines and that is the reason she's saying this. And you see 4th October she had come. Next again she said next time I'll get it checked and come properly after 15 days. 28th October she checked it. She said 146 and 193.
Some network problem may be the reason. Please wait. Diabetes mellitus is a very important thing which we need to face every day because there are a lot of adjustment need to be there in food stuff. That's the reason why such a subject was chosen by Dr. Chirag. As we all know that diabetes can be managed with our homeopathic medicine along with the diet management. But most of the dietitians are giving particular diet to the patient, but patients are not taking the not taking the proper diet, but also the timing is also very important. One need to take the food habit in a better schedule rather than what you eat also. Yes, Dr. Chirag, yes, please unmute.
There was some signal issue with my laptop.
Okay, okay, no problem.
So we were talking about that lady who said the medicines were over and that could be the reason it came above 200 level. So when I inquired, she said she has not started her allopathic medicine itself. It is only with that diet and what the medicine which she was taking, that was the sugar levels. And that is definitely very much appreciable results. And that is how even we get confidence in our treatment in prescribing certain diet, and that will again boost the confidence of the patient in whatever you say they follow it strictly. That was another case, and there was two more reports which I had to show, but the laptop is disconnected. Anyway, so the conclusion here is whatever medicines we are giving, yes, please do give it. And that is very much essential in bringing down the sugar levels in a very quick way. And even the patients will be very happy looking at the results. So I hope we all have got this take home message in prescription of the proper diet. And thank you one and all for allowing me to present the session here in IFPH platform. Thank you. Thank you. Any questions we can just answer.
Yes, it's really a very good session, and you have shown the beauty of management of diet as an important thing in managing diabetes, not only for diabetes, but also in all diseases. We can do such things so that the patient will be protected, particularly in chronic diseases.
Yes. Yes.
And at what time usually you allow the patient to take food, whether it is as early as possible in the morning or as late as, because most of the people have a eating breakfast. Sometimes most of the people may miss breakfast, and sometimes they may take the supper in very late in the night, and this has what is the impact that you expect from such changes?
A lot of people, they follow different ways of diet. Like some people will take very short and frequent meals. That is also good to keep your sugar levels in a proper pace. And many other people will do intermittent fasting, where they give 12 hours of gap, 10 hours of gap, and one meal in the morning, one meal in the evening. Before sunset, some people will follow. So that is technically very good, because before sunset means it will be before 6 o'clock. Next breakfast they will have in the morning after 8 or 9. So that will give a gap of almost 14 hours of fasting to the stomach. So that is also definitely helping people in reducing weight also. And late night having a heavy meal or any meal very late night is not advisable.
Yes, what I used to advise to my patients is it is better to take breakfast within 3 hours from your uh, as soon as you wake up, and better it is better to take the supper 3 hours before your bedtime.
Yes. So if people, if it is possible for them to have a meal before sunset, it is good. If they are traveling, working, other things, as early as possible, you can have. That is what we suggest the patients. So late night is definitely not good for the health.
What about your advice to non-vegetarian people? Because non-vegetarian people do have their own habit, and
They can eat controlled way of like red meat. Too much of fat, it is not advised. But whoever is having the habit of
most,
eating meat, that is definitely not going to increase the sugar levels.
most of the dietitians advise low carbohydrate and a high fat as well as protein diet for
Hmm,
diabetic patients.
hmm, hmm. So there is one more diet which is also called as the keto diet,
Yes,
low
yes.
carb, high protein. So yes, that can be suggested for the patients. And what I have spoken now is always it is also similar to that. That is always a good advice for the patients.
Yes. If anybody
And
has a question, you can ask the question now.
the result also is shown, the freshly diagnosed cases with reduction in allopathy, and one lady, she has not taken allopathy. There were two more cases where one more lady, she had 7.9 her HbA1c. My laptop had a problem, so I couldn't share it with you. And what I suggest for the freshly diagnosed cases, to have a glucometer, and whatever food they are taking, you have your regular food. After 1.5 hours, you check how much is the sugar level with whatever medicine you are taking. So that can track, suppose lemon rice they are taking, tamarind rice they are taking, roti they are taking, chapati they are taking, ragi ball they are taking, whatever the breakfast they are taking, after 1.5 hours, what is the sugar level? With medicine or without medicine, just track it for 8 to 10 days with different kinds of foods. So how is this helping them? That will help them to tune their brain, tune their brain in what types of food which will not increase the sugar levels too much, so they can consume them. For example, there are people who, if they take rice, sugar levels will be too much high. Some people are able to tolerate wheat chapatis, that will not increase their sugar levels. So for them, yes, you can go ahead with chapatis, you can add in your diet. That is what we suggest them. So your body is not so much progressed in the pathology that it cannot tolerate anything. It's not like that. So every patient is, as an individual, is different. Some people can tolerate certain things. We will allow them to take that.
Okay. And now I am inviting Dr. S. Sariga to say vote of thanks to the session. Dr.
Congratulations, Doctor, for such nice presentation. On behalf of IAPs, I extend my gratitude to you and thanks for your nice presentation. Please come again. Thank you, Doctor.
Thank you, madam. Thank you for giving me an opportunity to be here on your platform. Thank you.